Hi everybody, it's Kerry here at the North East Autism Society, and today I'm joined by Helen Leonard, who is a consultant paediatrician at the Great North Children's Hospital, and today we're going to be talking about personal health budgets. So before we start, Helen, could you just tell us a little bit about yourself, please?
Hi Kerry, hi, thanks for asking me to speak to you about something I'm really passionate about. So yeah, I do work at Great North Children's Hospital as a consultant and see children with developmental conditions including autism and learning disabilities. But I also have another role as well in a department of personalised care, usually around 1 day a month. And that personalised care encompasses lots of things about improving the day-to-day care of people with complex conditions, long-term health problems, and it includes personal health budgets. So that's why I'm speaking to you today really with those two hats on.
That's brilliant, and I know this is something you're really passionate about, Helen, because we've spoke about this in the past, which is why I wanted to get you involved to tell our families more, really. So I suppose before we begin, personal health budgets, why were they introduced? Why are they important?
So I'm sure this is something a lot of people will relate to. If you've got somebody with long-term medical problems or a learning disability or autism, sometimes services don't meet your needs. They're very much designed with a one-size-fits-all. This is our service, this is what we provide. And a lot of families and people with disabilities for years and years have found that they don't fit in the neat little box that's provided locally. And then there isn't a lot else, you know, there's not a lot you can do. And really in the 2000s, there was some pilots of different schemes to try and improve this. People have known about it for years, about, you know, lack of services for people or services that don't meet people's needs. So a group of individuals piloted this in control, where they were actually given a budget to set up and run their own care. And there was an independent evaluation of that, which was very positive. And then the pilot for personal health budgets themselves came in the late 2000s. And again, that was really successful. There was independent evaluation of that by a university. It was the evaluation and the funding for the trial was commissioned by what was then the Department of Health. But it was evaluated to look and see if this had been successful, and it was a massive success. So people got better quality care, their outcomes were better, but really interestingly, which I think people didn't anticipate, it actually saved a lot of money. And of course that then made it really attractive for health to pursue this as a policy, and it's now being rolled out much more widely to a great deal of success. There were targets set about the number of people they wanted on personal health budgets, and in fact these have been met and exceeded, and there's not many national programmes where that happens, but I think the reason that's happened is because they work for people. It's a solution designed by people on the ground for themselves, but this is what we need for our care, rather than somebody externally saying, you know, you should go here, or this is what you need. So you get to design your own solutions, and for many, many people that's been a big success. So then people have told other people, and that's why the programme has really taken off.
All sounds brilliant. So I mean, is there you've kind of covered it there a little bit, Helen, but is there a definition of what a personal health budget is?
So I'll read you, I have to look down to read this because I don't carry it in my head, but the formal definition is: a personal health budget is an amount of money to support your identified health and well-being needs, planned and agreed between you and your local NHS team. You can use a personal health budget to pay for a wide range of services, including therapies, personal care and equipment.
Okay, right. Yep. So I suppose one of the questions our families would ask at this point is there an eligibility criteria for a personal health budget, Helen?
Yeah, absolutely. So At the minute, the group of people that have actually have a legal right to them, which is set out in the Care Act 2014. But there are a group of people who legally are entitled to these, and a personal health budget is meant to be default position, so you should be offered one automatically if you meet something called continuing care criteria.
Okay, yes.
Now, this is kind of a bit boring, but it's important because people absolutely need to know if they can get one or not. There are criteria for children's continuing care and criteria for adults, which is similar but slightly different, but there's an important difference that will be relevant to a lot of the population of people that are interested in NEAS services. Mm-hmm. So for children's, I'll go through that first as quickly as I can.
No, that's really
there are 10 different areas that we look at. Now, remember, these criteria have to cover a range of people with every kind of disability and long-term health condition. So they're quite broad, but they do work pretty well. So there's 10 different areas we look at: breathing, eating and drinking, mobility, continence, skin and tissue viability, communication, drug therapies and medicines, psychological and emotional needs, seizures, and challenging behaviour. And I think the ones that are really, really relevant to the people that will be accessing NEAS services would be communication, psychological and emotional needs, and challenging behaviour.
Yeah.
So they would be the most common areas out of the criteria that children who access your services would have, will be those three. They may well have, coincidentally, other problems with mobility or breathing as well, but they're likely to have issues with communication, psychological and emotional needs, and challenging behaviour. And if you have if you're deemed as having a priority or severe need in just one of those areas, you should qualify.
Right.
If you have what's termed a high need in those three areas, you should be eligible. If you, for example, had a high need in just one area, you wouldn't meet criteria. Mm-hmm. So if you look through the children's continuing care criteria, and you've got either a priority or severe need in one area or a high need in three, then you should be eligible. And each area is sort of graded, sort of no need, low, moderate, high, severe, priority. Right. And there's a definition for each, what meets a high need for breathing, what meets a high need for communication. There's a definition. And the best thing to do is to just look up on the government website about continuing care criteria. It's actually clearly written, and somewhere there's a lot of documentation, but somewhere in that is the guidance for people about what constitutes meeting continuing care criteria for children. There's also an adult one as well, and there'll be quite a number of the people you see, Kerry, that will qualify for adult but won't qualify for children. And the reason is that is that in the adult continuing healthcare criteria, there's an extra domain of cognition. Right. So for children, a learning disability or cognitive needs are not taken into account separately. Sure, they might impact on the other areas that we're already looking at, like communication, but it's not a separate area. Whereas with adults, cognition is a separate area. So there are quite a few teenagers who at 16, 17 wouldn't meet criteria, but as soon as their learning disability or their cognitive needs are taken into account, they will meet criteria for adults.
Right, yeah.
And again, it's one severe or priority need or three or more high needs across the different domains. And, talking about criteria is a whole different talk in itself. We could spend a good hour talking about that, but it's quite complicated, and I think really you need to sit and look at it written down for people to pick through that.
Yeah, definitely. So I mean, the first port of call really, Helen, if people were looking, if they felt that they could potentially apply for this, how would they go about that? Where would they go to?
So I think one of the frustrating things for people is that they're not told about them, and that's part of the reason I'm speaking to you today, because I am really passionate. I want to spread the word about them. And most people, when there was a survey done by NHS England last year, actually, which was a repeat from the previous year, most people are still not finding out from health professionals, and often health professionals don't know about them. So it's often word of mouth from other families. But then if you feel you're interested and you might qualify, the next step is probably to speak to your social worker, if you've got one, and ask them to put an application forward. The applications can come from other people that are involved in your care. It doesn't have to be a social worker, but usually they are involved at some stage. So if you don't have one, ask to be referred to the Children with Disabilities team or the Adult Social Work team, if you don't already have one, and then do a little bit of reading so you understand that, and ask them, and ask if an application can be put forward, and that would go to your local CCG, and which is the clinical commissioning group. So the local commissioners who commission health services in your region have specially employed nurse assessors, right, who see if people are eligible or not. And then if you are eligible, following on from that, you would be involved in writing something called a care and support plan. Now, the interesting things about those plans is that in the past they were written about you by a social worker or somebody, whereas the whole point of personalised care and support planning is you get to decide what's important to you, what matters for you, what's working well, what's not working well, and what you would need to fix that, because you're the expert on you or the family member you're supporting or your child. You know what's not working with their care, and the whole point of the personal budget is that you can spend that on things to fix it. Now, there are, as you can well imagine, exclusions, so you can't spend it on gambling or alcohol, of course, things like that. But actually, the criteria are pretty broad. So, for example, if you were very overweight and that was affecting your general health, but maybe because of your autism you found it difficult to access group activities or things that had been suggested that don't work for you, you might have another type of exercise that you really want to do that you know might help bring your weight down, but it isn't provided by the NHS or at the local gym or whatever. So maybe you could use your personal health budget to help to fund you to do that exercise to lose weight. So like I say, it may be that so you would identify your goal as weight loss, and then the way you're going to do it and how you spend your budget is to purchase it to do
definitely.
X. So I see a lot of young people who, teenagers with autism and learning disability who are very overweight, for example, and they have been suggested that they go to a local on-the-go group. And while that's a brilliant scheme and it has worked well for some of the young people I see, for some of the others it's just not for them, and it's just not appropriate. So we need to offer something else, and there isn't an alternative. So it's about using your budget imaginatively to problem solve for you.
And it sounds like personalisation is really at the heart of this, of
absolutely
personal health budget. You just give us some little examples there, Helen, but have you got any specific examples of one that you've seen working well in practice?
There are some, probably if you want people to, I think examples are the best way of people understanding these budgets, rather than talking about policy or criteria, which is really kind of boring and it doesn't make sense. Actually, if you read about personal stories of people who've had them and the changes it's made, that's the most powerful evidence for them. So again, it's on the NHS England website. If you just Google personal health budgets, there's some good stories on there. So there's a good one about Dylan, who this is public information, so I'm not sort of talking about anything that I shouldn't be. He wanted a specific adaptation to his wheelchair, which meant he could live independently and be less dependent on carers when he went to university. But unfortunately, his local wheelchair service wouldn't fund that £2,000 adaptation. The knock-on effect is he would have needed a team of carers, which would have cost far more money, but also he would have lost his independence and his privacy as a young adult going off to university. So his budget enabled him to get specific adaptations to his chair and other things, so he could live independently and not need carers to help with his physical needs as much as he used to. So it's worked brilliantly. There's another example on there of a lady who's used an assistance dog to help her manage her diabetes and her seizures. And again, that's given her massive freedom in terms of not being dependent on carers, not going in and out of hospital constantly, and giving her independence and her self-confidence back following quite a severe head injury. Yeah. So there's some fantastic stories, and there's lots more out there.
Yeah, I've read some brilliant stories on what people can do, because it's so much more creative, isn't it, Helen?
Yes, yeah. And I think specifically for people with autism and learning disability who want to do lots of things, who've got masses of potential, but there are often just those barriers there, that it can be simple things like transport to get you to somewhere that you need, or there is a service that you want to access, but it just might not work for you, and it just needs some tweaks or adaptations or support for you to do it. And it gives the freedom to do that. And those kind of solutions are always going to come from personalisation and being seen as an individual and knowing what you need. It's not going to come from people externally who aren't living your day-to-day experience.
Yeah. Excellent. Well, thank you honestly so much, Helen, for coming on and talking to us about this, because I think it's something that maybe a lot of our families don't actually know about. So hopefully they'll find the information useful. And yeah, just a big thank you. So I shall see you soon. Helen, take care. Bye.
Thanks, Kerry.